Hi, I'm Rob Abbott, the Chief Executive Officer and Executive Director of ISPOR. Happy to talk today about ISPOR's bold new 2030 strategy, and in particular, how ISPOR is taking steps to address whole health and well-being. This is an incredibly important concept as we work to expand the definition of value to include health beyond the merely physical. Joining me for this conversation today is ISPOR President Eberechukwu and Associate Chief Science Officer Mitch Higashi. Iberi, as we think about whole health and well-being, the use of real-world evidence has the potential to play a really important role in facilitating this. Tell us a bit more about that.
Absolutely. Thank you, Rob. It's a pleasure to have this conversation on such an important topic. What's been intriguing to me are two big trends as we come out of the pandemic and think about what's next for healthcare. In 2024, a couple of trends I'm watching are the interest in population health, which continues to be a strong driver of the need for evidence. Post-pandemic, we really came to understand the importance of healthcare in context, is the way I like to think about it. Not only thinking about individuals' health status and health needs, but really wanting to understand their lived environment, their physical environment, where do they work, play, and live, and how that impacts healthcare. I've also been quite interested more recently in this trend, particularly called femtech. This idea of software, diagnostics, data, all kinds of tools that are related to women's health. And how do women collect data and experience health? And what are the opportunities there? By some estimates, women's health is supposed to become a $19 billion industry worldwide. And so there are immense opportunities there for an area that's really has been quite underserved by medical research. So those are the two big trends for real-world evidence that I think are worth paying attention to.
Just picking up on the technology theme for a minute, Mitch, one of the things that ISPOR has been tracking very, very closely and increasingly being much more active in is the role of artificial intelligence in health economics and outcomes research, and ultimately how that might be used to achieve better outcomes for patients. What's on your mind as we think about AI in HEOR?
Right, Rob. So we are seeing strong demand for ISPOR education in AI. We are seeing strong attendance for our conference sessions related to AI. Clearly, as Abari referenced, there's a need for people to navigate a complex healthcare market, and that includes complex data. So whether it's systematic literature reviews or actually developing code to query real-world evidence or model development or dossier development, HEOR was always a fast science, but AI is enabling us to move even faster. And we're very privileged to be at the top of the managing of that trend.
Just a quick follow-up on that, because one of the things that I've been interested in, and I know a lot of our researchers are interested in, is the potential for AI to help clinicians tailor therapeutic interventions to suit the specific needs of a patient and to do that more efficiently. Is that true?
Yes, absolutely. So the total scientific output of all publications has reached a high mark, according to Medline Citations, 1 million publications a year. Now, it took 20 years to go from 500,000 publications a year to current state, which is 1 million. The big question is, how long will it take to go from 1 million to 2 million, right? Will it take another 20 years? Probably not, because AI is enabling this massive productivity output. So the challenge for the clinician to stay on top of all this evidence is overwhelming. And so clinicians want to move to a new steady state where they can simply query an interface and get a review of the latest literature, the latest guidelines, and the latest clinical recommendations. So the demand is there, and the demand is partly being driven by this massive upload of information that we all have to stay on top of now.
Okay. Barry, I just want to come back to you on the real world evidence piece for a moment, because one of the things that I know a lot of our members and a lot of members of the public, for that matter, are interested in is the extent to which real-world evidence is really going to shape or otherwise inform clinical development, be that clinical trials or other forms of healthcare interventions. Any comment on that?
Absolutely. I think there is huge potential for that. We hear a lot about that discussion in cases where clinical trials are going to need additional information that's not ideally captured within the context of a clinical trial, such as when you need longer follow-up, when you need more generalizable samples in rare disease instances. So there's been a lot of interest in using real-world data, whether it's as external controls, to understand that comparative evidence even better, and then be able to apply it to the appropriate sample. Another area where I'm particularly interested in and where this interface of real-world evidence overlays with clinical needs, as was mentioned in our earlier conversation, was around clinical decision support. We talked just now about AI and its role. It has a clear role there, but I also feel as though the inputs matter. So what is the input into clinical decision support? It's data. It's real-world evidence. So the more accurate that evidence is, the more holistic it is. We've talked about whole health, well-being. The more that captures truly the patient's experience, imagine what that does for leveling up clinical decision support.
This reference to evidence is pretty fundamental. Now, ISPOR historically has been known as a professional society that curates scientifically rigorous, robust evidence to support healthcare decision-making. Mitch, as we kind of step onto a new frontier with real-world evidence, artificial intelligence, and so on, how do you see ISPOR evolving to better embrace this broader opportunity around evidence generation? Or maybe it's a broader need around evidence generation.
Yes, the broader need that we're hearing about from members is to make HEOR more relevant to more stakeholders. And so we're aware of some compelling examples, Rob, of HTA agencies. So they evaluate the clinical trial evidence that Ibarra referred to. They make their clinical and economic assessment, but they're moving downstream. It's a type of forward integration, and they're actually working with the IT systems to embed in physician point of care clinical decision support. So the physician, when they are ordering, they can actually pull up the chart to see, is this therapy recommended for this subpopulation? So it's a fascinating trend that Ibarra is talking about, where the loop is being closed. So previously, real-world evidence would be used to assess a decision and make an HTA assessment. Well, now that assessment is being hard-coded into the point of care. And the point of care is now generating real-world evidence back to the HTA agency. So this closed-loop system enables a bunch of new potential avenues. So, for example, value-based contracting, real-time assessments of how a therapy is showing progress in a population. So it's some exciting times.
So just on that notion of it being exciting times, so much of what we do can sometimes seem somewhat abstract. It's science, it's health economics, it's real world evidence and so forth. What does this mean for the patient? So I'd love to hear from both of you in terms of, as we think about real world evidence, what are the implications and opportunities for better patient experience? And similarly, Mitch, if we think about AI, how is that ultimately going to improve the patient experience?
One of the trends for 2024 that I've been particularly excited about is crowdsourcing data. And what that means is this idea that rather than the researcher going sort of door to door or survey at a time to get data, they put out a call, an open call, and individuals are self-selecting into that response pool. The reason why I find that really exciting is because there is power in recognizing that a lot of the important information about a person lies outside the healthcare system. And so there's immense value in figuring out how to curate that, but in a way that partners with patients. ISPOR has done a wonderful job with the Patient Summit, with the Patient Council newly created, to recognize that we really need to integrate the patient perspective throughout the entire phases of science. That feedback loop that Mitch talked about needs patient input all through. So this crowdsourcing is one important trend to me. It also says to me one other thing. We've oftentimes thought about data as something that researchers hold, governments hold, administrations hold, but oftentimes in spite of patients' preferences, that they don't want us to hold that information or they're not willing to give it up. Rather, what I found is this sort of quiet trend that's probably not getting a lot of attention is this idea that patients want to share their data. There are a lot of researchers I know that are quietly collecting meaningful patient-level data with the patient's buy-in and patients as drivers even. They're coming out and saying, I want to share my data. I want to be part of research. So if I might call that something, it's kind of trust. That trust is a trend. And that as researchers figure out how to become more trustworthy to patients, we will find them wanting to engage in research. And I think that's a very exciting trend because ultimately that's what gets us to answer the questions that matter to patients and then ultimately have that impact.
Fantastic. Mitch, from an AI and HEOR perspective and the patient?
Yes, I'd like to build on this crowdsourcing theme because one of our conference sessions at ISPOR, Rob, it was a case study. And so it was pediatric rare disease. This is terrible for parents, right? So on average, it takes 4 to 7 years for a parent to get an accurate diagnosis for a pediatric rare disease, a genetic causal factor. And it's just a terrible journey that these patients have to go on. But this case study, it featured a mom. And she had been trying to navigate the healthcare system for 2 years to get an accurate diagnosis for her child. So she then took all of the medical records and loaded them into ChatGPT. And without even any instruction on prompt engineering and how to interact with it, she figured her way through it, got the most probable diagnosis in 20 minutes, then was able to find the right medical geneticist and ask for this specific test and get a confirmation. So this is a new era, with the crowdsourcing, patients are going to be able to navigate the healthcare system at a new level. I do think ISPOR has a remit though, like we have to help train patients in prompt engineering, how to interface with large language models so they can speak that language.
This is a perfect segue into, the last question I want to put to both of you. ISPOR has this extraordinary new vision of a world in which healthcare is accessible, it's effective, efficient, and affordable for all. Audacious. It's going to require all of our members and all of our stakeholders working together if we're going to be successful. So if I could ask each of you, if you were making a call to action to our members and stakeholders, what would that call to action be to help us deliver against that vision?
It's a great question, Rob, and it is a great vision, quite audacious, I would say, but appropriate for this time because we have patients increasingly vocalizing a need for better healthcare. And when they say health, let's think about what they mean. I was part of a recent study where we would ask the question, what are your goals for your healthcare? And they would say things like, I want to feel better. What does better mean? It can't just be one-dimensional. And so they're talking about physically better, mentally better, socially better. So the call to action that I would propose to our membership is to take that patient view of health and ask, what does that mean for my day-to-day? Am I a data vendor? What does better mean for the kind of data I should be collecting and offering to my clients? Am I a researcher? What does better mean for how I should design my outcome measures in a way that marries and aligns as well with what patients are interested in experiencing? Am I an administrator or regulator? What does that mean for what I should be thinking about for population health, for regulatory policy development? So I really feel like one of the things that unites us as a society is the patient. Let us have that ground then how we approach our day to day. And then I feel like we're on our way to achieving that vision.
Wonderful. Mitch?
Yes, Rob, 3 calls to action from the science department. So, number 1, join one of our special interest groups. We have a broad array of special interest groups, 12 at the moment, plus 3 additional digital communities. Number 1, join one of our special interest groups, learn how it works. Number 2, propose new ideas, because we could end up with some great ideas to develop a new special interest group. And then number 3 builds on what Abare said, which is tell others. We want to get other stakeholders, including patients. We don't want to be in a vacuum of the HEOR profession. We want to get other stakeholders joining these special interest groups.
That's fantastic. Thanks to both of you for joining me today for this conversation. I've really, really enjoyed it, and I appreciate your input. ISPOR is on an extraordinary journey to achieve this vision of a world where healthcare is accessible, effective, efficient, and affordable. We will build on our legacy and lead the definition and use of value for health and healthcare decision-making. At the same time, we will step bravely and boldly onto the new frontier to become the trusted HEOR authority that is leading change in health policy worldwide. To do this, I call on all ISPOR members and stakeholders to join us. Think about how you can take your science, your interests, your concerns to policymakers and decision makers in your home country, because together we can transform healthcare, and that ultimately is why we do what we do.